can, but most of the time don't.
Okay, not bad, but there's a little more to it. Let's see. Who haven't I picked on yet?
Is
Vin.
poison?
Oh, hang on. Vinny first, and then whoever was going to speak next.
So with poison, it can have a massive systemic effect on the entire body, the function of the body, the organs, and it can have a very long acting life and long-term effects as opposed to just short-term.
Okay. But can't my aspirin? I take an aspirin every day.
Yeah, but you gotta take that in mass quantity, where poison, depending on the type of poison, it could be trace amounts and your body can go into organ failure.
Okay.
For example, arsenic.
All right.
Arsenic has a long-term effect.
All right, but my body can go into organ failure by also taking, Tylenol. All right, we're getting on the right track. Who is the female voice that started coming up?
It was me. It depends on how.
What's in me?
Oh, Shadane.
Thank you, Shadane. Go ahead.
It depends on how fast your body processes the drug. The slower it processes it, there's a possibility of poisoning or overdose.
Okay. But again, I take a lot of medications because I'm a very unfortunately unhealthy person. If I don't take those medications properly, I can really hurt myself, can I?
Yes.
Okay. So Elizabeth, you're on the right track. Okay, go ahead. Tell us about the difference between poison and a drug.
Poison introduced into the body is always going to have harmful effects. Your drugs can have harmful effects if you take them incorrectly, but can have positive effects if they're taken too.
Okay. All right. Very good. Very good. The only thing a poison will ever do to somebody is cause harm. All right. A poison was made to cause harm or death to somebody, where a drug, right, is supposed to have, positive and desired effects and has a use to it. So let me ask a question. Cocaine. Hey, cocaine's a hell of a drug, right? Hey, Casey, cocaine's a hell of a drug, right? I'm old if nobody gets that joke.
I'm older than you, Maria.
Sorry, it is.
So Casey, does cocaine have a medical treatment value to it?
Yeah, it's oh, this goes back to the classifications of drugs. Oh my God.
Nosebleeds. No, that's what's caused by cocaine.
No, damn, I literally knew this not that
What
long
was
ago.
cocaine used? Okay, why? What was cocaine used back in the early 18 and 1900s? Why do we use cocaine?
As a stimulant.
Not a stimulant. It was for pain management. Good, Shadane. It was pain management. They used it during surgeries, okay, to put people to sleep. It was an anesthetic. Until people started realizing that it can be used for sexual purposes and as a stimulant. And yes, Coca-Cola, because it made people happy. But in the beginnings of medicine, cocaine was used actively in anesthesia. Okay, it is still a drug nowadays. Okay, and it could, of course, be a poison because depending on what goes on with the cocaine, how it's cut, how it's laced, unfortunately, throughout the decades, people have unfortunately done so much stuff. It's not pure cocaine anymore when it gets to this country. All right, so a poison, the only purpose of a poison is to harm somebody. Very good. Okay, so we're going to go past this. As far as poison control centers, if you've used them, congratulations. I have tried using it. They are useless because, let's see, Gary, if you call poison control because your kid swallowed antifreeze, what is the poison control going to tell you to do?
Look it up.
Look it up? No. That's what.
No, we had a.
Go to the hospital.
And Newmick, a girl was brought in because she drank glass cleaner, a certain type of glass cleaner for bongs.
Okay.
And the doctors called poison control because they weren't familiar, and they basically spent like half an hour looking it up because they weren't even share of it.
Well, so, right, but you're inside a hospital. I'm talking pre-hospitally.
Monitor?
Yeah, what are you gonna, and I heard everybody say it, monitor and diesel right to a hospital. They're gonna tell you to call 911 and go to a hospital. It doesn't matter if your kid took your own pill, like your metoprolol, or if they drank a liquid underneath your sink. Poison control is gonna tell you to go to the hospital. Anybody know in the old days? I hate to say old days because Elizabeth and I, my poor things. In the old days, what did they tell you to do, Elizabeth? You remember?
Charcoal.
What? What did they tell you to drink?
Drink
Or
some milk.
the syrup of ipecac, charcoal, induced vomiting. There was a whole bunch of stupid
Yep. And what else? What else coats your stomach?
milk. He was saying
Milk.
like
Yeah.
there was all sorts of crazy things that they.
Yeah, it was poison control used to tell you to drink milk for everything. And then, yeah, if anybody's ever seen a Family Guy episode with syrup of ipecac, don't do it. It's out of protocol for a reason. People died from that.
Because
And
you
people
do
die
not
from
want to bring it
choking.
back up, it will kill you.
Yeah. No.
I had
And-
to call poison control once for my dog.
Okay, but what did poison control say? Go to the vet?
No, they were like, "Oh damn," because my 60-pound pit bull ate pre-workout.
Okay.
It was wild.
Listen,
So-
it happens. But the whole thing is, you're not going to sit on the phone. You're going to treat signs and symptoms, and you're going to go to the hospital. That's basically the answer here. So honestly, I don't find in our area, poison control doesn't really function. Now I can understand in areas where you have a 2-hour trip to a hospital, might be a little bit more, functioning, especially a lot of other places do have activated charcoal still on their ambulance. Fine, but not down here on Long Island and in Upper New York. Hospital.
And you know what? If you want to call on the way, if it's something really strange, so that they can start working on it for the hospital, that's fine. But I don't think I would
Sure,
even.
if they want, if they
When I
believe you.
lived in when I
I've
lived in Buffalo, they had
Oh.
extended transport times of up to like an hour. So
Mhm.
they still had syrup of I don't even know how to say
yeah.
it. They had that. They had like a bunch of other stuff in like protocol, and it was so weird to like think about that.
Yeah,
Like
I believe it
they were
could
so
still
like
be.
liberal with so many different things too. And then you come down here and they're like, you don't get to do anything.
So the only
Right.
time I've had using it, I've had to use it twice, is if you know exactly how much they took. So like one time I had like a father spray his daughter with bleach and they didn't know what to do because I couldn't tell them how much. And the other time I knew somebody drank a dish soap and then they were very helpful then. But you have to like know how much the person actually took. You can't be like, oh, they got sprayed twice. They're gonna be like, I
Right.
don't
Yeah. No, we are detectives, whether it's pill bottles or bleach bottles or anything like that, trying to figure out how much they took and then your body weight. I mean, obviously, we're not going to sit there trying to figure all this out, but we need to treat signs and symptoms. But yeah, poisonings are very difficult. It's get yourself to a hospital as soon as you can. Okay. So we're going to go back in time a little bit. Okay. Back to our pharmacology, back to like our hazmat and stuff here. We have our, let's see. Oh yeah, women kill men all the time with arsenic and mercury and everything else. So just so you guys know, if you piss off your wife, you better watch what's in your food, just because. So, but anyway, so a cholinergic. Okay, it's funny because they say a cholinergic is uncommon, not out here in Suffolk County. Okay, Svi, what do we have out here in Suffolk County that people can be exposed to all the time? That's funny.
I have no idea.
You have no idea. You don't live out in Suffolk County, huh?
Pesticides.
Steven, do you live out in Suffolk County?
I live not as far as Mike Brown from Suffolk County, but still pretty far. So now,
So what do you have an abundance of in Suffolk County that they don't have in the city?
They have farms and organophosphate.
Yeah, they got farms. And what do you find on those farms? Don't say cows or llama or alpacas.
Pesticides.
Pesticides. Good. Okay, so we're going back in time here. So if you were exposed to a cholinergic, what acronym might you see? What acronym might you see on somebody? What do we call that stuff?
Dumbbells, right?
Okay, dumbbells or
Is it sludgeum?
good. Yep, sludgeum or dumbbells. Very good. All right, awesome. So you have sludgeum or dumbbells. Okay. Salivation, lacrimation, urinate. Let's see, I think I got it on here. Here we go. Defecation, emesis. Dumbbells include seizures on there too. Okay. Who remembers their pharmacology? Tom, you remember pharmacology? What is our treatment for an organophosphate overdose?
Atropine.
Atropine, good. What's the other one? Because this one might you see on the test. Okay. Atropine is what type of drug? Atropine is classified as what?
Parasympathetic. Blocks the parasympathetic nervous system.
Oh, atropine. I know the other one. Fuck.
No, atropine is not a parasympatholytic. Don't put that answer down. Okay, good. I got the answers here. Yeah, it's an anticholinergic. Good. It's an anticholinergic.
The other drug's 2-PAM that they use for medication.
Very good. And I would know about 2-PAM because you might, this has been test questions. Does anybody know what 2-PAM does?
Got me there.
Okay. So let me go back, Tom. I'm not going to say that parasympatholytic is wrong with atropine. It's just, it does break it down. My whole problem is every exam I've ever seen or taken in my entire life never had that as an answer. It always had anticholinergic. All right. So not that parasympatholytic is incorrect. There is just a better answer as an anticholinergic. And I want to make sure everybody understands that. All right. So you can say the other one. Yes, atropine is from a plant. We'll talk about that in a minute. But what does 2-PAM do?
I want to say
Okay,
it works similar to Narcan. It like competes for the receptor and kicks it off.
Oh, I don't know how to answer that one. It's not that it kicks it off. There's a better word for what it does. It doesn't kick it off. It
Occupies the site.
no.
Does it bind to the site?
No, more about not blocking the nerve agent or inhibiting. Okay, it reactivates. That's the best word to use. 2-PAM reactivates something in our body that breaks down what's going on. Anybody know There we go. That's what I want to hear. Reactivates cholinesterase. Good. What? All right, hang on. So it reactivates cholinesterase. I'm writing it there. Did it not come up? The heck? Let me try again. Cholinesterase. Okay. So cholinergic, that's what's making the sludgeum go down. ASE to break down, reactivate what's breaking down this product. All right, so it's going to reactivate cholinesterase. That's how we fight a nerve agent. Okay, another test question that I've seen. Can anybody name one of the biggest nerve agents that's out there, especially used in the Middle East a lot?
Sarin.
Sarin gas. Good. Excellent. Okay. Sarin gas, tabin. All right, good. Nerve agent. So any type of nerve agent is a cholinergic. Yep, VX. Thank you. Good. Got to go back in our brains for a hazmat lecture. All right, so being exposed to sarin or tabin or VX or anything else, you get sludgeum. Yep. VX is, it's not that it's one of the big ones, it's one of the most deadliest, VX. Yeah, most people use sarin gas. All right, so we know that atropine is an anticholinergic. If you overdose somebody on atropine, okay, what are the effects, okay, that you will see? If you overdose somebody on atropine, that we got here, who didn't I call on yet here? We'll go back. Christopher Lopez, you overdose somebody on atropine, what might you see?
I'm not with tachycardia.
Wait.
Actually, funny enough with that, if you give more than 3 milligrams of atropine to somebody, what happens to their heart rate?
Bottoms up, probably.
It does. It's a reverse bradycardia. Yeah. So we can only give a max of 3 milligrams. So you might actually see more of a bradycardia than anything else. Okay. But
Maybe.
what are you gonna? Yep. Go ahead.
I don't know, maybe like some type of like heart, maybe like palpitations or something, like
Okay. So let's say you give within the 3 milligrams.
Right.
Sure. That's where you'll get your, your tachycardias and stuff like that. Okay. But what else? If you overdosed on Benadryl or you overdosed on tricyclic, okay, you can get a
Maybe.
prolonged QT. Good. That one's prolonged QT. But what else can you see?
Would it cause a seizure? Could that cause a seizure?
It could. I mean, in the long run, but what would you see first, even before the seizure?
Like
Probably.
dilated pupils or something?
Very good. There we go. Here we go. Next slide. Dilated pupils. The initial will cause a tachycardia. Big one here, dry, flushed skin.
Mm.
Okay. Did, let me, give me, let's see, trying to, okay. So there are little memes out there. Let me see if I can get to this. Let's go here. Let's see. Okay, here we go. Here's a cute little thing here. I don't know if I can bring this up. Ah, I hate when the images are too small. Right. This bigger? Nope. This one is what it is. Okay. So when you have an anticholinergic overdose, okay, we have these little sayings. You will go mad as a hatter, okay, blind as a bat, red as a beet, hot as a hair, and dry as a bone. Okay, mad as a hatter for altered mental status. Okay, blind as a bat for mydriasis. Does anybody know what mydriasis is? I hope you guys, you need to know this word. This was on the last National Registry exam. Mydriasis. Yep. Anybody know what that is?
Dilating of the pupils.
Very good. Okay. Anybody know what the opposite of mydriasis is?
Meiosis.
Good. Not meiosis, meiosis.
There you go,
I ain't
meiosis.
forming cells there. Very good. Meiosis. Very good. We're not splitting cells down. Anaphase, prophase. There you go. Good. Flushed skin, red as a beet. Dry skid, anhidrosis, hot as a hair. And very dry mucous membranes. Remember, we're counteracting the salivation, so you can be dry as a bone. Right? But I had this on my National Registry exam. They gave me a 4-year-old with atropine toxicity. What am I going to see? And I remembered this acronym. If you remember this stuff, okay, it will help you a lot when you take your, if you decide to take your registry. Cool. Awesome. All right. And then what do we do if too much atropine? Hey, honestly, yeah, we have no real antidote, monitor fluids, hospital kind of thing. That's correct, James. All right, this stuff is easy. Your hallucinogens, PCP, your LSD, peyote, your mushrooms, don't go licking toads, mescaline. Hey, somebody is on one of these things, Okay, you guys need to be very careful. Call law enforcement. If you're not a paramedic already, get them there. Okay, we have seen people who are on this who have been shot and stabbed and they still come at you. I have given people the max amount of Versed and Benadryl and Haldol and everything else to these guys. They will still, yeah, strong as an ox is right. They can lift cars. And the problem is they can choke you to death and they won't even know that they're doing it.
Are you talking about PCP?
Honestly, any type of hallucinogen. PCP is the worst one. Okay, but I remember my cousin, he took too much peyote one time. He started to hallucinate and started to attack people because he thought everybody was Batman. It was hysterical. But it doesn't matter. He had a giant bat in his hand and nobody was getting close to him. All right, but PCP is the worst one. All right, LSD is just following. It's not as good. Depending on how much mushrooms that you decide to lick, you might just hallucinate. But any of this stuff can make you violent. Okay. Well, what's an MDMA? What's MDMA? What's the street name for them?
Molly.
Okay, Molly's or Sally's. What's going to go on with a Molly or a Sally? You might hallucinate, but is it more of a euphoric hallucination?
You're gonna feel good. It's euphoric.
Correct. You're going to do that like ecstasy, euphoria. Okay. What kills you when you do a Molly? What causes your death? Anybody know?
Dehydration.
Secondary to.
Doesn't
Okay,
their
Gary, medical term,
temperature
please.
rise?
Yep, medical terms, please.
Fever?
I've got heat, fever. Nope, medical term for temperature rising.
Hyperthermia.
Thank you. Severe hyperthermia, temperatures of 107. At EDC concerts, if you ever talk to anybody from Paradox, they usually have a kiddie pool that's full of cold water or ice or something, and they just slam people into it.
Yeah, we had that 2 years ago.
Mm-hmm. Yep. So a Molly or a Sally, they are going to overheat to temperatures probably as high as 107 degrees. Okay, but it's more of a psychedelic. Same thing, mescaline here. I've heard people, if you take mescaline correctly, you're more of a euphoric psychedelic. Okay, peyote is supposed to take you on a whole new level. Okay, I believe native tribes use peyote to go through their spirit walks. Okay, but it doesn't matter. Anybody who is on a hallucinogen can become violent. So just please be careful. We treat the signs and symptoms. Is Sally new? No. Sally is a form of MD. God.
MA.
Yeah, no, it's give me a minute. I'll look it up. It's MDA. Yeah, it's a small there's an ingredient that's different. Yeah, it's MDMA versus MDAs. As I say, ecstasy is an MDNA, MDAs are Sally's or SAS, but no, they're around. Okay. Cool. But we treat the signs and symptoms. You get somebody, if you can get close enough to them and they're having delusions, they're having seizures, what do we give? What do we give for these people who are hallucinating? What do we got in our arsenal? That's cute. What else we have in our arsenal?
Versed.
Versed. Okay, and I'll tell you, it doesn't always work. I hate to say it. I wish we had, the B52 combo. Okay. Yep. Whatever benzos you have, honestly, you're going to be using a lot of it. Okay. Do not get injured with hallucinogens. Be careful tying people down. They will rip through their skin. Okay. They're like wolves who chew their arms and legs off just to get free. So be very, very careful. All right. If you have to know something, here's your triad. We know this. Opioid triad, AMS. Okay. Respiratory depression or hypoventilation and pinpoint pupils. That shouldn't be anything new to anybody. Okay. The only difference now, guys, you're medics, you should know all the different types of opiates and opioids out there, whether they're, synthetic, okay, or they're, made in a field. Okay, so start doing that pharmacology. Okay, like this one. Who's got this? Mr. Brown, what's meperidine?
Do not know.
Okay, meperidine, anybody?
Isn't it an antihypertensive?
It isn't, no, it is an opioid. Could it be used for an antihypertensive? Not
I saw that in the ICU for hypertension.
for secondary to what though? Do you know what they probably came in with?
He came in with a 10-foot ladder fall. He had your brain.
okay.
He was a vegetable. He was being put on Live-On.
Okay. I was going to say, because people usually come into the ER complaining of this and they ask for meperidine all the time, and it's the main treatment for it.
Does that start with an M or an N?
No, that's an M for meperidine, and it's true, Demerol.
Fetapine or something.
No, not if yeah, meperidine, and it is Demerol. People come in complaining of the worst headache of their life, and they'll usually look and they'll ask you for Demerol. All right. Yeah, I saw somebody say carfentanil. Sure, carfentanil is a very potent elephant tranquilizer. So this is where the higher doses of Narcan may come into play. But guys, I saw somebody say that, cops gave 14 of Narcan and whatnot. I've been there, done that. It has consequences. You can't just keep jacking somebody with Narcan. The last time they did that, my patient flashed. You can't do that.
The guy that got 14 was already in cardiac arrest.
Okay, so I'm going to comment on that. If you are already in cardiac arrest, unless the arrest happened right in front of you, Narcan will not work. You need a circulating body, of oxygen and ventilation, actual respiration to have Narcan work.
I got a question.
Somebody said, can too much Narcan make a patient seize? I'm never going to say no. I've never had it happen to me before, but I will never say no to an overdose of medication. Go ahead. Is that Gary? Who's talking?
No, it's me.
Harrison. Sorry. Go ahead.
I never gave that much Narcan. Was the person big, like bigger than?
No, because unfortunately, the police are taught that if somebody's unconscious and overdose, that they need to give as much Narcan as fast as they can. And so remember,
or like
they don't ventilate after they give it, and so it sits and they just keep giving it. If you have an experienced PD on scene giving Narcan and you get there and it's just absurd, it happens a lot out here on the island, Harrison.
Yeah.
Yeah, it does. It happens with my precinct too. And I try to tell them, and I'm never far behind my guys. I'm usually 30 seconds to a minute, if anything, behind them. And yeah, 14. Remember, the Narcan dosages that's given from the pharmacy to people, that's 4 milligrams. 4 milligrams per shot. It's like 0.1 mLs.
Yeah.
Okay? So, and they gave 3 one time. And I'm sitting there going, oh my God, you got to be kidding me. Like, you got to give 4 and then ventilate and give them a minute. But if you're already in cardiac arrest, the Narcan is not going to work.
Yeah.
Yeah, unfortunately. It's one of those like last ditch hopes that we do. But yeah, that's well, you're supposed to also keep the head back and a lot of other things that they don't do. Yeah. All right, so sympathomimetic. All right, remember, different. Atropine is not a sympathomimetic. I'm sure you've seen this on exams. People get it wrong all the time. Okay, you're sympathomimetic, right? So you're overdosing on your epinephrines, okay, overdosing on norepi. That's why we need a dial-a-flow or a pump to give norepi. You just can't do it wide open. But you will find the same symptoms: dilated pupils, tachycardia, elevated blood pressure, anything that's the reverse of a sludgeum. This is your fight or flight. Okay. Again, the only thing that we can do for this, okay, just like it says, we're controlling the paranoia. Okay, benzos, and more benzos. Stimulant overdoses like cocaine, you're benzos. All right, so Versed has a lot to do in our pocket. Oh, you got Rosk on that, Gary? That was good. Hey. Like I said, try everything. All right. Let's see. I got any test questions here? Let's see. All right. We know all the complications, blah, blah, blah. So let's talk about some antidotes here. All right. Anybody who took an acid or anything alkalytic, right? You sucked anything that's underneath your cabinet down. All right. Hospital fluids, monitor, hospital, airway control, hospitals. Nothing we can do about it. All right. Okay. Anything in regards to, again, eating, eating coal, I find funny because activated charcoal, but eating coal is not a good thing. Okay. Charcoal is fine, but not pure coal. I don't know why anybody would do it, but whatever. All right. Going back to your hazmat, does anybody know what volatility means? What's volatility?
How susceptible you are to it?
Not how susceptible you are. What does volatility have to do with the substance?
Resistance of flow.
How likely it is to react with something else.
So how dangerous it is.
Getting there. Getting there.
Oh, it's how quickly it vaporizes.
Okay, so one definition could be how easily it evaporates. All right, very good. Or the ability to change rapidly. Yes, the ability of the substance to change rapidly. But yes, so I mean, you guys hopefully you fill up your gas tanks. Every time you go to a gas station, you smell gasoline, correct? I mean, it's just inevitable. That's the volatility that you're smelling. You're smelling that gas. It's coming to a gas, and it does it pretty quickly. All right, so that's why anytime you smell something in the house, you should, ventilate the house or get out really quickly. All right. Again, usually unintentionally, unless you really want to hurt yourself. Treat signs and symptoms. Okay. Methanol, funny enough, you say the cure for methanol poisoning, like antifreeze, would to be start a vodka drip on yourself. Don't do that. All right. But somebody said they're, dogs. I used to be a vet tech and they drank antifreeze, and my aunt and uncle started a alcohol drip on him. So yes, okay, vodka is an antidote for methanol poisoning, but we don't do that. Go to the hospital. Okay, other types, paints, detergents, anything like that. Just get the bottle, get what they ingested, try to get their weight, monitor, airway control, IV, hospital. Okay, keep going. Let's see what else we got. Alcohol. You'll have a lot of people, especially in nursing homes, okay, that are ETOHs. They don't have any access, okay, to store-bought alcohol. So you'll see them drinking Purell off the wall. You'll see them try to drink isopropanol also. Don't be surprised if somebody in a nursing home is trying to drink Purell to get an alcohol high.
I got a
That's true, Gary. Yes. Go ahead.
I had a 911 call. Yeah. The person drank. It was so disgusting. I nearly threw up. It was like, like the antiseptic Listerine, like the brown one.
Well, that's what Vinny just said too. Yeah, go ahead. Mm-hmm.
Yeah, I got this woman in like a Rite Aid. She stole 2 bottles of it and stole 2 bottles of Gatorade and was mixing them and drinking them, walking around the store until she finally passed out in the aisle.
Yep, just to get that small amount of alcohol high. Yep.
Oh.
Yep.
Anthony, was it you or Who was at Newmick with me when the lady took the fucking the Purell into the bathroom and drank it?
Not
that was me. I was just about to write that. It was a guy who was there overnight. He went into the bathroom and drank an entire bottle of hand sanitizer, and then crashed very hard.
Yes.
I don't know. I wonder if he made it.
I've had numerous calls like this, but this is how much of an alcoholic, and we're going to talk about DTs later on, but I'll tell you, man, people will do anything, okay, for a high. They really will. Okay, so don't be surprised, if certain things start to become locked up. We already know that you have to go behind the pharmacy to get a lot of medications. The pharmacy locks up a lot of things. It's not just because of stealing, it's because they have to ID people. So I wouldn't be surprised one day if Listerine, is behind the front counter, or Purell is behind the front counter because people do stupid things. Okay, metals, lead poisoning is still around. Unfortunately, I hate to say it, but lead is still in schools. Kids eat lead. Lead is in the water supply, unfortunately. Mercury, if you're using old thermometers and you drop a thermometer, do not touch mercury. Okay, it will go through your skin and into your, it will be absorbed through your skin very quickly. Okay, and you can die from mercury poisoning. Right? There's another way somebody can get mercury poisoning very easily. Anybody know?
I think.
Harrison, I'm sorry, what'd you say?
Thermometers.
Eating
Beside,
Fish?
I think.
yes, V said it. Yeah, somebody said it. Eating certain types of fish, like tuna.
Yeah.
Yep. Shark fin, tuna. Pregnant women have to stay away from certain fish because of mercury. But yeah, this is where history comes in. Somebody's showing signs and symptoms of mercury poisoning, and if it's not their wife, you need to ask what they've been eating for the last week or two. So people who are on pescatarian diets can have mercury poisoning. That is true, but a lot of hospitals don't check for mercury. Okay, you have to point them in the right direction. Okay, I mean all these metals, iron. Children are not supposed to have iron. Okay, it's very deadly to their system. Okay, you shouldn't have too much iron in your body. You're not Magneto. Don't do it. Okay. Yeah, mercury poisoning is really bad. If you ever, I think in The Sixth Sense, in that movie, I think it was mercury that they were using. It's a slow, painful, death, and it's very hard to figure out unless somebody just happens to pull for it. All right, food poisoning. If there's nobody here who's ever suffered from food poisoning, congratulations. Okay, it is devastating. It will usually come on within 24 to 48 hours after you eat something. All right, we have fluid, we have Zofran. That's great. Treat them nicely. Okay, don't eat from sketchy restaurants. The end. Even though when I worked in Queens, the sketchy restaurants were the best restaurants. All right, salmonella found in poultry. Okay, how do we get botulism in a can? Anybody know how botulism's formed?
Yeah, canning improperly.
Canning improperly, and then dents in the can. Never buy a can that's dented. It will cause botulism. Okay, what other food product has a lot of botulism in it and should not be given to children under the age of 1?
Honey.
Honey. Thank you, Mom.
You're welcome.
No problem. Yeah, small children cannot have certain foods because of, the bacterium that's in it to process these foods. All right, honey has a ton of botulism in it.
I could still remember my grandmother yelling at me when we were little. Make sure you put an acid in the sauce before you can it.
Grandma was right. You got the botulism. What else has a lot of botulism in it that women put in their face all the time?
Botox.
Botox. Yeah, Botox. So botulism has a lot of good uses too to it. All right, just not good when it goes into our GI system. Okay. If you've ever been on a cruise and you've escaped the noro or the rotavirus, congratulations. But these are the two most common types that you get on cruises. All right. It's not going to kill you. Yeah, exactly. But you're just gonna, we're recorded. So you're gonna poop your brains out. Basically, you're gonna piss out of your ass and you're gonna vomit for a couple of days. Anything longer than 3 days, you need medical attention for because you become, dehydrated. All right. It's obviously wonderful. Wash your hands all the time because, yes, in order to get this, you are drinking water or you're eating feces. God bless hepatitis A. Okay. Please don't go around eating or smoking plants that you don't know what they are. The end. A lot of plants are poisonous. Okay, especially to animals too. Anybody know the pretty plant that we have around Christmas time that you better keep away from your animals?
Poinsettias.
Yeah, poinsettias. Beautiful plant, very dangerous. Okay. Before, I think it was Vinny said, a lot of our drugs are made from plants. That is very true. Okay. Okay, digoxin, atropine, a lot of those are made from plants. Okay, can't eat this stuff. You'll kill yourself. Right, again, asphyxiants and corrosives. Monitor their airway. Right, intubate as necessary. IV, hospital, the end. Right, cyanide poisoning. Hey, let's see, who can tell me what happens with cyanide poisoning? Who haven't I called in on a while here? Alexis, talk to me about cyanide poisoning.
Cyanide poisoning. It takes, I think, doesn't it cause ataxia? Like it takes, so it causes respiratory arrest and frothing at the mouth. Maybe see.
Okay, yes, but why? What does it do inside the body?
I don't know.
Okay, binds to hemoglobin, saturates the body, right, causing what?
Respiratory. Stops your oxygen from perfusing your organs, your cells.
Right, there you go. Yes, it prevents the cells of the body from using oxygen. Good, good, good. Very high affinity for hemoglobin. Yes, it is. Okay, it's over 100 times affinity for it. Your blood loves cyanide. Love them some cyanide. Tom, what's the antidote for cyanide? What do we use?
I believe it's hydrocobalamin.
Okay, hydrocobalamin. Yep, hydroxycobalamin. Can't speak today. Good. Tom, what vitamin does hydroxycobalamin hopefully turn the cyanide into?
Is it ammonia?
No, vitamin.
Vitamin. I'm not entirely sure, but Svi says.
Okay. So Svi would be correct. Svi would be correct. It's vitamin B12. Excellent. All right. James, what do we use in conjunction with hydroxycobalamin? I have no clue. That's all right. You're allowed to have no clue. Casey, what do we use?
I'm not sure either, to be honest.
All right. Karai, I think I might have gotten that right for once. Karai, what do we use?
Is it bronchodilators?
No.
Is it like sodium something with a T? I don't know how to pronounce.
It is
Sodium thiosulfate.
Thank you. Okay, Svi got it again. Whoever just said it, Christopher, sodium thiosulfate. All right. When you get somebody with cyanide poisoning, they want you to take blood on them first. So you're going to draw some blood tubes. If you can get 2 IV lines, that's great. Hydroxycobalamin goes first. Sodium thiosulfate goes second. Very, very good, guys. It is, James, but it depends on how much cyanide. And honestly, your treatment, no matter what time it comes, is better than no treatment, because the longer you leave cyanide in the body, the more deadlier it is. So even if you get to somebody half an hour afterwards, you start hydroxycobalamin, go for it. Have to do it. Have to. All right, don't mix chlorine and ammonia together. Okay, you'll get chlorine gas and die from one inhalation. Keep a window open when you're cleaning. That's easy. Honestly, guys, any type of stings or bites, no tweezers. Use a driver's license or a credit card. Get the stinger out, clean it with soap and water, mark the area with a circle, and treat appropriately. You can go into the allergic reaction protocol if you need to. If the area starts to swell up, you can put a VCB above the site, keep your arms and legs below the heart. Honestly, though, I mean, again, It all depends on how venomous they are and what bit you. So again, we spoke about, no, maybe my other class spoke about brown recluse. Can't remember what class I'm in. But brown recluse spiders, okay, no matter what you do, the bite is going to get worse over 21 days. You can have necrosis and ulcers forever, but at least it's treatable. Okay, wasps, bees, and stuff. Second time you get stung, you can go into anaphylaxis. We're just treating signs and symptoms here. Go to the hospital. Right? Does anybody know the only poisonous poison venom center we have down here in New York? I heard it. Yeah, Jacoby. Why Jacoby?
It's across the street from the Bronx Zoo. They have all
That's
the.
correct. It's next to the Bronx Zoo. Good. Yep, good. We get all of our anti-venoms from there. All right. We don't need to identify, Rocky Mountain spotted fever or Lyme disease. Okay, that has to be obviously diagnosed by a doctor, but Lyme disease from deer ticks, very common down here. Okay, you'll have a lot of joint stiffness. I see a doctor if you're young and all of a sudden, you like to be in the woods and you can't move, probably Lyme disease. All right. As far as snakes, stay away from them unless you like them. The end. I love that. I think I said this to my other class. If you get stung by a jellyfish, please not piss on one another. We don't do that. Okay, not going to work. Lifeguards usually have some type of ointment or vinegar for you. No peeing on people. You peed on yourself. It's not going to work. That is really funny. All right, go to the lifeguard. They have stuff. Pain management, monitor signs and symptoms, hospital. Okay, let's see. I don't even know what slide are we on here. Okay, we're on a lot. We have a little bit more to go. So what I want you guys to do is take 15 minutes, come back at 10:45. Okay, go get some coffee, stretch your legs, do whatever you have to do. And we'll continue with this topic. So 10:45, come on back. Here. If I could find my sharing. Here we go. All right, back to the good stuff. Back to recording. Poisoning people. Love poison. No. All right, so we did our sludge before. We got our atropine, our 2-PAM. We treat with benzos for seizing. That's great. Let's see. We know how to do opioids. What else we got here? Okay, so anybody know the antidote for a benzo overdose? We don't have it. Does anybody know what it is?
I had a benzo overdose yesterday, and I do not know the answer, and I'd love to know that because I had the call yesterday.
I think it's
That's cool. Anyway, so somebody said something.
flumazenil.
Okay, good. Flumazenil or Romazicon, good. So now the problem is a benzo overdose. Hospitals may not use the antidote because the flumazenil actually has so many worse effects to it that patients end up crashing from the flumazenil more than just sleeping it off, like Steven says. Yeah.
Actually, let me correct myself. I'm sorry, because it was not specifically, I don't know if it still works, but it was actually Klonopin and Xanax. What are they where are
Benzos.
they? Okay, it's both of them, right?
Yeah, benzos. Mm-hmm.
Okay, so yeah, this girl took like 35 like Xanax and like I don't even know how many Klonopin.
So she was either very, very sleepy and zonked
She
or
was
flying high on a
literally
kite.
against the wall, eyes closed,
Yeah.
but still standing.
Yep. Airway management, IV, monitor, and that's, and that's it. So most doctors would rather you sleep it off than actually do anything for it.
Yeah, that's exactly what basically happened. Like we basically put her in sleeping and just monitored her.
Yep. Yeah, that's right, Steve. So what Steve said is taking, 33 or 35 Xanax, because it's usually 0.25. I mean, you still, so you take a quarter of
I think hers was,
33.
I think hers was 0.5.
Okay, so still, so you take half.
I think I could be. I don't know.
Which is, which is still, close, a little more than 15 milligrams, which is a lot. But again, it's just gonna,
Yeah,
usually some people call them strokes. They look like they're having a stroke.
she just was like literally against the wall, like, and she would open her eyes, like if you like slapped her in the face a little bit or something, she'd kind of like roll and look at you a little, and she was breathing like in like the 12-ish range.
Yeah, because she's feeling good right now.
I don't know. I feel like I'd throw up at that point, but okay.
No, your body's too relaxed to throw up.
Yeah. So, yeah. Anyway, yeah, we transported her, and she was breathing and kind of like helped roll herself a little bit onto the bed there. But yeah, and doctor.
Right. Yeah, you kind of just push them over and they're all flaccid. But Steven's correct here. The alcohol benzo combo, I've had people drooling on themselves. A lot of people call in stroke notes when they have both combination on there because you're so depressed now. With alcohol involved, I'm always worried about the breathing. So monitor, IV, okay, airway management, hospital. Okay, the end. No antidote for barbiturates. Okay, monitor, treat for seizures. Okay, all right, stimulant overdose. Here we go. Who knows what speedballing is? You might see a test question sometimes on speedballing. What's speedballing? What two drugs together?
Heroin
and cocaine.
Good, heroin and cocaine. So you take heroin and you take cocaine. Which one overrides the other one?
So it's you take the heroin, but the cocaine can override the heroin, right? Until the cocaine wears it.
Opposite.
No, I'm jacked
Opposite.
up.
Yep. Nope. The heroin will actually override the cocaine. Okay. So when you get to somebody who is speedballing, you'll probably get the opioid triad. So we give the Narcan. Now what happens?
They're
No, now that's then the coke kills them.
Not kills them, but the cocaine kicks in.
Yeah.
Their pupils dilate.
Yeah.
Their heart rate goes up. They start sweating. They can become violent. So
Yeah.
be careful. A lot of times
a lot of like celebrity overdoses are from that.
A lot of celebrity overdoses are from, medical management done wrong. But a lot of people are lacing things nowadays, and unfortunately, cocaine has been laced with a lot of things. K2 gets laced with a lot of things. So you just be careful. You might counteract one drug, but then the other drug is going to come into full effect. All right, so just be very, very, very careful. Okay, when you use your Narcan there, always be prepared for another, like not only a violent behavior, but another medical emergency. Paine's a hell of a drug, PCPs, that's right. Lots of benzos here. All right, test question. Always going to be a test question, whether you see it on your New York State, your NRP. TCA, tricyclic antidepressant overdose. What do we use? There we go. Bicarb. Good job. Bicarb. This is always a test question. I've seen it everywhere on almost every exam I take. Okay, these are your triptylins. Amitriptyline, nortriptyline, anything that ends in iptyline is a TCA. Okay, you can have a widened QRS and a widened QT interval. You'll probably be unresponsive, right? If you are responsive, the dry mouth, blurred vision, fine. All right, but any triptylin, okay, get your bicarb out there. All right, it's going to be a lot of bicarb too. And luckily, like I said, Nassau County, I could probably do almost whatever I want, but you're going to be given at least minimum 2 amps. I've had patients like this who end up on a bicarb drip because their pH goes from 7.2 down to 7.1. They can make TCA overdoses can make you very acidotic. All right. So, but again, I've seen bicarb drips before. We don't need a bicarb drip. We're too close to hospitals. Just keep pushing the amps of bicarb. All right. All right, let's do this first. Psychedelic drugs. Okay. If you overdose on a psychiatric medication, any psychiatric medication, we'll take Haldol. What's your antidote, okay, for certain psychiatric? And I'll give you a hint. If you have a psychiatric overdose, med overdose, you could be doing these type of maneuvers. What is your body going to go into? What type of maneuvers or positioning? Anybody know what those are called? All right, I'll put it up here. What's that?
Posturing.
What type of posturing? It has a specific word. Okay, so I'm putting it in the chat. An overdose on psychiatric meds. Yep, very good. We got that. Somebody thought was going to say it before me. You can have a dystonia or a dystonic reaction. This is basically your body doing the Cirque du Soleil, like you're going to go upside down and twisted and look like the Exorcist.
Why does non-compliance with psych meds result in catatonic states?
It depends on the underlying reason you were on that medication in the first place, because a lot of these affect your dopamine receptors, and your dopamine is for your happiness, your euphoric receptors. So if you don't have enough they believe that if you don't have enough dopamine being produced, okay, that your happy center is not there, so you kind of just gaze off into thin air. Right, but it depends on why you originally put on that medication in the first place.
Gotcha.
But usually it's because of some type of dopamine problem.
Thank you.
No problem. But yeah, so the dystonic reaction, you got your Cirque du Soleil, you're upside down, you're sideways, you're contorted, very painful. What is the antidote for a dystonic reaction? And we do have it on the ambulance. No, not taught this in farm. Anybody? Not calcium. Give you a hint, it's an antihistamine.
Benadryl?
Yep, Benadryl. Go ahead. Okay. Yep. You can give them usually 25 or up to 50 milligrams of Benadryl. Usually 50 works pretty well. Okay. Okay. You also have to remember, okay, we know Benadryl is an antihistamine, but what other type of drug is Benadryl? Anybody know what other type of properties Benadryl has in it? Okay, it's also an anticholinergic, so it will have like the same properties as atropine too. Well, Benadryl makes you tired. Okay, that's the antihistamine part of it. But yeah, so like me, my sister and myself, you know how they tell you to give your kids Benadryl on an airplane? Well, my mom regretted that. My sister and I have an anticholinergic response to Benadryl, and we were hyper. We were, mad as a hatter, red as a beet, tachycardia, everything that was going on, dry as a bone. We were running around.
Also,
That's how my mom reacted. Say that again about antiemetic.
I personally take it for the antiemetic properties when I'm.
Yes, it's also an antiemetic, correct. Yep. Yes, it is. So Benadryl has a lot more properties than we know about it. And Steve, yeah, if I take Benadryl, I am up. But you're correct. So again, got to know your pharmacology. There's a lot more to drugs than we just learned too. Yes, Atrovent also has anticholinergic properties as well. That's another reason why we can only give 3 Atrovents to a patient. If you give more than 3, you can have an adverse effect and actually cause the opposite effect and cause bradycardia. Yep. Atrovent is also anticholinergic. Good, Ramses. All right, cardiac meds. That's cute. Douse yourself with NyQuil. All right, we don't have the antidote to Dig. Okay, what's the antidote for beta blockers? What do we use?
Glucagon.
Yeah, glucagon. Lots of it too. We probably don't have enough in our ambulance, but we can try. What's the antidote to calcium channel blockers?
Calcium.
Calcium, that's easy. I wouldn't use benzos for nausea. It's not our first line treatment. That would be under a GI advice. I have acid reflux for the last 15 plus years, and I've never used a benzo. Okay, so that's something you have to talk to your doctor about. Of course, any medication can be. You just have to find the right one that works for you. Sure. I mean, I was using Reglan, which, you know, Reglan has a bunch of different properties to it, but somebody gave it to me for hypertension one time as a combination. So any drug can be used for anything off pharmacy use. Hopefully your pharmacist, which mine is really good over at CVS, when it's off pharmacy use, they actually come out and talk to me to make sure I know what I'm using it for. So yeah, so that's how, you know, when somebody's unconscious, you get a list of their meds. We all make assumptions, we're allowed to, but just know that other meds are used for other things. Okay, like psychiatric meds can be used for seizure disorders. Yeah, I'm not really sure. I'd have to look it up.
Yeah, no, I'm saying
Right.
I went on a call. We like picked up a patient from from like getting like cancer like infusion treatment or something, and they were like sick. So we picked them up, and like
I
we
don't know,
saw
I'd
them.
have to,
It was like a thing. Like they did it. It's, I think
maybe,
it's like
I mean, it's also an anxiolytic too, which maybe calming somebody down might help pain too, but I don't know. I'd have to look that up.
yeah, it was interesting. I don't know when not now, but whenever you get a chance, it's like benzos for nausea. I think it's for cancer patients or something like that.
Okay.
Some,
Definitely look that up.
some because Zofran and the QT interval and all that stuff.
Okay. That's cool.
Random connection. I don't know. I heard it somewhere, so I don't know.
Listen, I'm always up for reading another, you know, journal article or anything. Like I said, I teach pharmacology. I know a lot about pharmacology. I don't know everything about pharmacology. I don't know if it's even possible to know everything about pharmacology, you know, but we know the basis in order to, you know, assist people. So if a cancer patient tells me that they use Versed for their nausea and they're puking their guts out and they can't have Zofran, you know, discretionary, I'll call medical control, see if I can get it. Not a problem for me. No problem.
Why in the ER, like in all of my rotations, I must have hung 50 famotidine drips. Why do we?
Pepsid is the ship. Pepsid is what fixes me with acid reflux attacks. It is a cheap.
No
It
contraindication.
is. I believe it's cheaper than Zofran, I believe, and just easier to run and safer to run into people because you don't have to worry about the QT interval.
Right. So why don't we carry it? I feel like there's nothing contraindicated.
Because yeah, that it's a good question. I don't know the answer to that one. It's maybe it just hasn't been researched by doctors. I honestly don't know, but I wish I had Pepsid on my ambulance. It would cure me a lot faster too. But no, I honestly don't know.
Because like that
It's a
was more of a
proton
first
pump
line.
inhibitor.
It was more first line than Zofran was. Like everyone.
Because it's safer. Yeah, you're right. It's safer.
It was like a 50 milliliter bag of just dripping Pepsid all day.
Yep. Yeah. Plus, it gives you fluid at the same time. Yes. So no, I don't know. I don't know why we have and we don't have.
Too.
What's that?
I said it's also given an anaphylaxis. There's a lot of things that we could use that for.
What, Pepsid?
Yeah, every anaphylaxis that we had in the hospital too. That was the first one of the first things they hung.
Interesting. I wonder if that's because of the gastro effects on it.
I think it's the H3, right? Pepsid is
H3. Yeah, H3 inhibitor. It's a proton pump inhibitor. Yeah. Interesting. Yeah, no, I don't know. I wish I had a lot of drugs that I don't. All right. Okay, MAOIs, anybody's on any psychiatric medication or, okay, MAOI can't be mixed with a lot of other drugs. All right, but just somebody overdoses on this, it's just airway management. NSAIDs, Okay, can't do much for the NSAID overdose management. All right, this one's the bad one. All right. Okay, your salicylate, especially your Tylenol, there's a reason why it says you shouldn't take more than, I think it's 4,000, which is a lot, 4,000 in 24 hours. If you overdose on Tylenol and you do not get the antidote within 24 hours, you will die a slow, painful 2-week death. Okay, you need acetylcytosine. Okay, I have to see how to spell that. Acetylcytosine is the antidote, but it's only given in a hospital and it has to be given within 24 hours. Otherwise, your liver, yeah, it's acute liver failure, but it goes on for 2 weeks and it's extremely painful death. All right, so a Tylenol overdose is a very, very, very serious thing. Okay, so get them to the hospital as soon as you can. Okay, so there's your Tylenol overdose. Yeah. All right, we talked about our uppers and downers, our mollies, our ecstasies, our sallies. All right, so let's see. Thought I saw a test question on alcohol dependence. I guess not. Okay. All right, so we spoke a little about alcoholism and what people would do just to get a certain fix. Okay, alcohol actually makes our body hypothermic. We need to remember that. It might feel a little warm and fuzzy going inside, but your body temperature actually drops. Okay, it does reduce anxiety and your blood pressure, which is nice. Okay, that's why a glass of wine, or of red wine, I should say, every night is good for your heart. A bottle of red wine every night is not good for your heart. So be nice after paramedic class. Okay? It is a depressant. We know this is not anything new. I think my computer just froze. There we go. All right.
Maria, I have a question.
Go ahead.
It's kind of unrelated, but are there specific types of strokes or CVAs that cause hypotension as opposed to hypertension? Like, there was a doctor that I met yesterday who was saying that small vessel occlusions can present with hypotension as opposed to large vessel occlusions or
Okay.
hypertensive states.
Something if it was a neurologist saying it, then I obviously I would agree. It was an ER doctor. I would have to research it myself. Again, I never can say no to anything because medicine is forever changing, and I haven't worked with a lot of SVOs versus LVOs. I get more large vein occlusions than I do small. So, or at least the ones I've ever found out about. But if an ER doctor said it, I'd hope it would be true. You just have to research that on your own. And another reason why, as much as vital signs and things like Cushing's and posturing are great, if it looks like a stroke and sounds like a stroke and you think it's a stroke, no matter what the blood pressure is, you go with your gut.
Because we
But I
ran
always tell people
yesterday that both went into stroke alerts and were both hypotensive states.
Interesting. Okay.
It was like we had the hesitancy to call it as a stroke alert because of the hypotension, but if it looks like a duck, quacks like a duck, it's a duck.
Well, that's basically, then you remember, that small vein occlusion may be causing like a vasovagal event in there too. So who knows? Who knows why it might? I'd have to research. I really have to research why it happens. Okay, but yeah, nope. If it, like I said, walks like a stroke, talks like a stroke, call it in like a stroke, and let the hospital figure it out.
Yeah, I didn't know if it had to do with like a specific part of the brain and that why, like maybe, who knows, you get two people who are having the same kind of occlusion or whatnot.
Yeah, I'd have to look it up myself, unfortunately.
Appreciate it. Thank you.
No problem. Okay. So Wernicke-Korsakoff or Wernicke's encephalopathy. We used to carry thiamine around in our ambulance. Okay, thiamine is vitamin B1, helps with absorption of a lot of carbohydrates and basically metabolism. Okay, a lot of alcoholics would have what we call Wernicke's encephalopathy. All right, it's lesions on your central nervous system after you've used up all, your vitamin B, specifically vitamin B1. Okay, and so we would carry thiamine around. The problem is we'd have the same, drunks that we pick up over and over again, and now we're giving them thiamine poisoning. I mean, it was a poor, never-ending cycle. So if you ever wonder why a banana bag is called a banana bag, right? It's yellow. The thiamine is yellow in color. Yeah, banana bag. Thiamine is yellow in color. Okay. But Wernicke encephalopathy, all right. A lot of vision problems, ataxia, confusion. I mean, just think about all your intoxicated patients. Might not just be from the alcohol. Now the alcohol might have caused issues actually with their central nervous system. Okay. And then if the Wernicke's is not treated properly, all right, you can get Korsakoff psychosis. And that's where you have memory deficits, confusion, and behavioral changes. So Wernicke's encephalopathy, untreated, will lead to Korsakoff psychosis. All right, and again, you need a neurologist, you need a CAT scan. Trying to give people more vitamins will help. All right, but once it gets to the psychosis part, I'm not sure. I have to look up the recovery on it. But I want to say a quarter of the people that go through this remain psychotic, unfortunately. I think it's a quarter. I have to relook that up. All right. Eye issues, your nystagmus, okay, ataxia, disturbance of speech. This is why you have your alcohol, all your drunks on the street, you cannot rule out a CVA, right? That's for the doctors to do, right? Because they have all the symptoms of having a stroke. All right, so if you have to call a stroke note, I know once you say that they've probably been drinking, they might off-put it, depends on what hospital you go to. They need a workup. Lots of workup for these patients. Okay, you just give them fluid, check their BGL. We do everything that we need to. Yep, alcoholism, gastritis, ulcers, Mallory-Weiss tears, which is your esophageal tear. I've seen that on test questions. Okay, a Mallory-Weiss tear is an esophageal tear from persistent alcohol abuse. All right, yep. Then you get your wonderful cirrhosis of the liver. Your liver stops to function. It's a wonderful thing that goes on. Pancreatitis. Okay, I mean, alcohol is just terrible after a while. Then you go through withdrawals. If you're a chronic alcoholic and you don't have a drink for 6 to 8 hours, you can start having alcohol withdrawal syndrome. And then 24 to 48 hours, we're going to get our DTs. Right? And how do we treat DTs in the field? Anybody know? How do we treat delirium tremens in the field?
Monitoring and fluid.
And
Benzos.
if they're so bad, yeah, benzos. It's almost like having bad seizures. Yeah. Monitor fluid. And if they're so bad that they're tremoring so violently, benzos. Yep. I'll need to know that. Cool. All right, that was pretty long, but let's see.